Today is Diabetes Alert Day. It's a one-day wake-up call that focuses on the seriousness of diabetes and understanding one's risk. In the U.S., 1 in 3 Americans has prediabetes, which equates to about 98 million people. And according to the CDC, 81% of these individuals don't even know they have it. Dr. Bala is here to talk about the risks and what you can do before the disease can progress any further. Good morning. Thank you so much for your time this morning.
You're welcome.
So talk to us about how you can tell and how so many Americans can have prediabetes and not even know it.
Yes. So, prediabetes sneaks up on you because it doesn't necessarily give you any symptoms. The way you find out that you have prediabetes is to get a blood test and look at the level of blood glucose. And it's a screening test. And unfortunately, people just don't screen often enough, or the health system is such that, it doesn't promote active screening for the majority of the population. So it goes undetected for a very long period of time until the patient lands up in an emergency room or a clinic with problems. And by that time, they've probably spent many, many years in the pre-diabetic state when things could have been done to slow down its progression.
With that, once you get that diagnosis, are there steps you can take to reverse prediabetes and even prevent or delay getting type 2 diabetes?
That's a very, very important point. I think one of the important reasons to figure out if you have prediabetes is exactly because things can be done to slow down the progression. So the word reverse is a little bit fraught. I don't know that we can actually turn back the clock completely, but a number of really excellent large-scale trials conducted by the NIH and by other groups have shown that you can certainly quite drastically slow down the rate of progression to the actual condition, which is type 2 diabetes. So this can be done by many things. One is primarily lifestyle change. So weight loss, if one is overweight, regular exercise, and careful attention to diet, particularly to stay down, keep down high calorie dense, high glycemic foods, as they're called. All of those help, but they have to be done fairly consistently. There are also some medications which, if taken in the pre-diabetes state, can slow down the rate of progression to type 2 diabetes. One of these is the well-known, very effective and extremely inexpensive drug, metformin. And maybe the combination of metformin with lifestyle changes can be an excellent way to slow down the progression of prediabetes.
Dr. Bala, we hear a lot about, as we're talking here, prediabetes, type 1, type 2. Do you believe there are more types of diabetes? And if so, understanding this spectrum, do you believe that this could change treatment?
And that's a wonderful question and a very perceptive question. It is still stuck in the practice of medicine and in the minds of most physicians that there are essentially 2 types of diabetes, type 1 and type 2. We believed this for a century. But it turns out that diabetes is much more complicated than that, and particularly as the epidemic of diabetes spreads through parts of the world where we have people of different ethnic groups and different races. It turns out there's, in fact, probably a spectrum of diabetes. Now, there's no question that there is something very significant and can be diagnosed as autoimmune type 1 diabetes. When you come to type 2 diabetes, it's much more variable. There's much more of a range of how it can present. So right there, you have increased complexity. And if you label somebody as having type 2 diabetes, you don't actually specify which, subtype they might have. And we're getting to the point where we should be able to do that. And the other thing is that apart from type 1 and the range of type 2, there's a whole spectrum of what we now call atypical diabetes, some of which may have a genetic cause. And there's very active research going on to understand these atypical forms of diabetes, which may not be very rare, but they might actually be quite frequent, but they're never diagnosed because people are not thinking about them.
For more information on diabetes and all the different types, where can people go for more information?
Oh, yes. So that, I think the website of the American Diabetes Association is very helpful. The CDC has websites which are very helpful. And if people are interested in understanding the atypical forms of diabetes, or if you feel that you have an atypical form of diabetes that doesn't fit into the usual standard kinds of type 1 or type 2, there is a wonderful study called RADIANT, which stands for the Rare and Atypical Diabetes Network, funded by the NIH, for which Baylor College of Medicine and the University of Chicago are two centers. And there's a website for Radiant. If somebody would like to look into that website and give us a call, we'd be more than happy to provide information on the whole range of different forms of diabetes and how they might be diagnosed.
Yeah, absolutely fascinating. We appreciate you and your time this morning, Dr. Bala. Thank you so much. We, of course, will put all of this information inside this article on our website, clicktohouston.com. Thank you.